Hello, everybody. Good morning. I hope everybody is feeling well and that you all's first session went great. So I am Kenyatta Watkins, and I am going to be presenting today for you all. We're going to be talking about building the team. Everyone wants to join, and these lessons are coming directly from my care coordination team at Chicago Family Health Center. All right, so great to see everybody wanted to see me this morning. I think everybody's going to enjoy this. I think it's very much aligned with the purpose and vision of this year's conference, which is purpose, right? So I think that you guys are really going to enjoy this presentation. So let's get into it. So here's our agenda. I'm going to talk a little bit about me, my organization. Then we're going to get into the topic of the hour, which is employee engagement, how that looks at our organization. I'm going to give you a little insight into some things that we do specifically for our department, and then we'll go into some next steps for you all to take back, as well as some questions and answers, all right? So here are our learning objectives for today. So one, we're going to identify practical, low-cost strategies to boost team morale through peer recognition, celebration, and consistent staff engagement practices. We're going to analyze real-world examples from a care management team to understand how internal initiatives can lead to measurable improvements in team satisfaction and retention. And lastly, we're going to develop adaptive leadership skills to navigate varying work styles, foster trust, and create a team culture that balances professionalism with authentic connection. So very, very, very detailed. All right, so a little bit about me, the fun stuff. So again, my name is Kenyatta Watkins. I have my bachelor's in sociology from Northern Illinois University, and then I received my master's in health administration from National Louis University. I have been at Chicago Family in this role as manager of care coordination. It'll be 2 years in December, but I am excited to be back actually at the organization. I got my first big girl job out of NIU right at Chicago Family in the Family Case Management Department. And I actually presented at IPHCA when I became a care coordinator. I want to say it was 2016 when they were in Geneva. I left once I got my master's, went on to do complex care management at Cook County Hospital for county care. And then during the pandemic, I actually helped with starting up a care coordination team with a startup company called My Own Doctor. And then I got a call from a colleague at Chicago Family, said, hey, this position's open. I think you'll be great. I was one of the original care coordinators when they started the department, so I was excited to apply and even more excited when they accepted me back. So that's a little bit about me. I have one child. He's 18. That's actually the baby that I took with me to college at NIU. Full circle moment, he's a freshman at NIU now, and I'm so proud of him. And then my baby girl pup, Nova. Isn't she beautiful? I had to leave her for the weekend, and she hates it. She hates it. So that's a little bit about me. Now let's get into our health center. So Chicago Family Health Center. Anybody in here familiar with our clinic? Oh, yeah. And I got some Chicago Family Health Center employees in here. Hello, team. So we were founded in 1977. Our clinics are primarily on the south side of Chicago. We have five clinics. So we have our South Chicago location, which is on 91st and Exchange. We have Roseland, Pullman, Chicago Lawn, East Side, and then we have a school-based health center, which is in CBCA, which is really close to our main site on 91st and Exchange. We service about 30,000 patients annually. So a lot of patients, which means we have a lot of staff and we have to keep a lot of people engaged, right? So here are our core values: commitment to community. Being on the south side of Chicago, we do service, in which most of us, right, all of us really being FQHCs, we service vulnerable populations, right? We're in those communities with people who really do not understand healthcare or maybe not even the value of it. So we're pushing and promoting healthcare in these communities. We want to be inclusive. So we're servicing the populations and that people can come in. They may be uninsured, underinsured, they have Medicaid, they have Medicare. We want to make sure that we're inclusive to all of our people. As well as leading with compassion, right? We're in underserved communities. These people are very vulnerable, so they want to know that we care about them. So we definitely stand true to that value, as well as being patient focused. Because when we are dealing with vulnerable populations, They want to know that they matter, right? They want to know that the care we're providing is centered around them and that they have a voice. So we want to make sure that we're educating them and putting them in position to be able to tell us what it is that they need as well. And then lastly, but most importantly, right, is our quality. We want to make sure that we're providing quality care to all of our patients. All right, so let's get into employee engagement. So what is employee engagement? Anybody in here want to take a stab at that? What is employee engagement? I'm going to be very interactive, so somebody answer. I may just bring you the mic. Thank you. You want to say your name?
My name is Ann. I'm one of the HR people here.
Oh, nice. Hi, Ann.
Employee engagement to me means the extra effort that people put in above what is absolutely expected of them from their job.
Love it. Thank you, Ann. Anybody else want to take a stab at that? HR, right? She's like, well, they're like, well, you gave the answer. You are for the people. Great answer. So here are two definitions that I found that I wanted to point out. So salary.com says employee engagement refers to the emotional commitment and dedication that employees have towards their work in the organization they work for. It goes beyond more job satisfaction and reflects the level of enthusiasm and involvement employees have in their daily tasks and overall mission of the company. But I wanted to include this quote that I found. It's a book called Inspired Excellence. If you haven't read it, it's an amazing book by nurse Rich Blooney, and it just talks about leadership in healthcare. So he says the satisfaction measures what you get from a relationship with an individual or an organization. Engagement measures the reverse, what you give back to that relationship. So I think that this simplifies but speaks profoundly to what employee engagement is. It's what we're giving back to our organization. So another question for the group. Why do you all feel like employee engagement is important? Somebody different, please. Okay, great. That's a great one. Anybody else?
Helps reduce turnover.
Great. I think y'all looked at my slides. Okay, so here are three things that I wanted to point out in regards to employee engagement. So it improves productivity, improves the quality of care for our patients, and also reduces turnover. Great one. So when we're talking about productivity, right? So employees who are engaged are more connected to their work and produce greater results because they care, right? When you care about the work that you do, then it is going to reflect directly in your results. And I'm sorry, in the work that you do, right? So we want to make sure that these employees stay engaged because when there's a sense of connection, it's definitely going to show in the work that you do. The quality of care, similar to the first one. When employees are engaged, they create a better experience for our patients. If I care about you, if I'm compassionate, then you're going to feel that, right? If I'm cold and you come in the room and I'm like, hey, it's just like, okay, you don't really want to be here, and then now that affects me as a patient, right? So when you're engaged, you're going to let that patient feel more excited. Even maybe it's a bad day for them, maybe they're coming in and they're getting bad results, but you can still give them a different perspective just based on your personality and things that you're bringing. So that's a very important one. And then turnover, right? So employees who are engaged are less likely to leave us, right? Because again, they care about what they do. They want to be at the organization, so they're like, okay, I love it here. I want to stay, which is, hence coming back to Chicago family. I'm like, I love the organization. So, we want to make sure that we're keeping our people engaged. Okay, so what happens when employees are not engaged? Anybody want to take a stab at that? I promise I won't the whole presentation ask questions, but go ahead.
Employees producing bare minimum. They're not going above and beyond. They're just doing what they can to get by.
Great one. Thank you. Anybody else? Yeah. Anybody else?
Create a negative work environment for their coworker.
Yeah. Exactly. Yes. Thank you. So it's a lot of those reverse things of what I talked about on that previous slide. So low morale, right? And then low morale can affect other employees. So employees who are unengaged or disengaged, right? They lack motivation and the desire to be at work. So they're coming into work. They're like, okay, let me just get through the day. Nothing extra, none of that. I just want to just punch the clock and get out of here. There's a higher turnover rate with these employees because they're less likely to value the work or care about the organization. It's just a means to an end for them. So they're looking for other opportunities because more than likely it's just about the money. So they're like, okay, who has more money for me, And then low patient satisfaction, because as I mentioned, right, when we are engaged, it positively impacts. So if we're not engaged, then it's going to negatively impact our patient satisfaction because, again, you're coming in negative, you don't care, you're not showing any effort. So then the patients are like, I'm not coming back here. I'm going to go over to this other clinic. They make me feel safe. So now we're going to get into just a couple of case studies, just so you guys can kind of guess the difference between the two. So Andre is 34 and has been employed at your company as a care coordinator for 4 years now. He rarely takes any time off and is always on time for his shift. The patients love Andre due to his warm demeanor and joyful spirit. Andre is always willing to help resolve issues, and staff often look to Andre for support when they have concerns due to Andre being one of the longest standing staff members. So would you all consider Andre to be engaged or unengaged? Engaged. Great, yes. Andre is definitely engaged. Rachel. So Rachel is 38 and has been employed at your company as a care coordinator for 6 years now. Rachel has always been one of your top performers and never bothers you with concerns about her role. Rachel is very reliable, so you often challenge her to step up and be more of a leader on the team. But she prefers to come in, do her job, and go home. Nothing more, nothing less. Is Rachel engaged or unengaged? Great. And I would even like to add, I'm speaking a lot about engagement and unengagement, but disengagement is also another term that can go into this. And the difference between being disengaged and unengaged is a disengaged employee is someone who was originally engaged and then they became unengaged, right? And unengaged is someone who never was engaged at all. So we could even say that Rachel is a disengaged employee. Okay, so now let's get into the stuff that you guys are really going to care about, right? What are some things that we do in care management? So before I get into that, I kind of wanted to give you guys an insight into the department so you can kind of see who we're working with. So our care management department is composed of actually 3 different teams. So we have our CMO who overlooks our department, and we have our director of care manager. Then it's myself, the manager of care coordination. Our director also oversees 6 nurses, and then she also has 2 flexible housing pool case managers. Then I have a team of care coordinators, and then everybody is across all of our sites, right? So we have employees housed at all sites, and then there are 3 different teams. The main thing that we do in the care management department is our team is responsible for keeping our patients aligned with the goals that they have, right? So we're making sure that they're safely transitioning from maybe they're inpatient, so we're making sure that they're getting out of the hospital, they're following up with their doctor, we're addressing SDOH needs if there's anything, and we're also making sure that they're connected to all of the services that they need. And that's even if they're not even inpatient, but maybe they're just a patient who comes into the clinic and needs services. So that is basically the overview of our department. Our care coordinators specifically handle our SDOH. So that's housing, food, clothing. I'm sure everybody here is familiar with SDOH. They complete health risk assessments for our county care patients, as well as our Aetna Better Health patients at the clinic. But they do address SDOH needs for all of the patients at Chicago Family Health Center. They also assist with addressing care gaps. So if we have a patient who needs an appointment, my team will help with that as well. They're educating the patients on their medical home and how to contact the clinic if they need to make any further appointments, as well as assisting with ED follow-ups for our patients. So we're constantly watching and monitoring ED discharges for our county care patients as well as our Meridian patients, and we're scheduling those follow-ups. Our care managers handle our more complex cases, and specifically our county care and Aetna patients. They'll do comprehensive risk assessments. For our county care patients, they also create care plans where they'll follow with those patients every 30 days. They also assist with our ED follow-ups as well as inpatient follow-up care. And then they are responsible for delegating to my team as well as they'll assist with our behavioral health team as well. Lastly, our FHP case managers, which is really a new part of our department. We're going into year 2 with these 2 case managers who are primarily responsible for housing patients that come through SSHCO, which is a partnership that we have, Southside Healthy Collaborative in Chicago. So they'll help these patients get housed as well as provide them with SDOH needs as well. So I just wanted to give you guys just a quick overview of what our teams do so you can kind of have an idea of the type of environment that we're working with. The loads can be a little heavy for them emotionally because we're always addressing complex needs or social needs of our patients. So we want to make sure that we're keeping them taken care of and valued. So what are some things that we do to keep our staff engaged? So we have had an annual planning meeting, quarterly in-person meetings, quarterly birthdays, as well as quarterly awards. The annual planning meeting I actually did for the first time last year, and it was a great, response on that. So what I did was similar to what an organization does at a higher level, right? With our board members, they go on a retreat or have a meeting where they'll come up with a strategic plan, right, that the organization is supposed to follow. So I took that strategic plan, the mission and vision of our organization, and I sat down with my care coordinators and said, what does this mean to you? And how do you feel like our department adds to these things? So within the meeting, they were able to, we split up in groups. We discussed what were some areas of weaknesses that they felt like they had last year and what were some, what are the areas of improvement as well as the areas that they feel like we did good in. From there, they were able to identify ways that we can improve, and we were able to, make a plan together for the year. It also helped me with being able to hold them accountable because a lot of the things that they wanted required things from them too, right? So it wasn't just coming back to me and what I would do as a manager, but what they could do for themselves. Quarterly in-person meetings. Where right after COVID, during COVID, we all went virtual, right? So now we're hybrid. My team is completely hybrid. So they're in the office 2 days in the office 3 days, and then they're remote 2. So we came up with quarterly in-person meetings, so that way the team can come together. And because since we're all at different sites, this gives a time for people to come from other sites and be able to engage with each other. And during those meetings, we'll either provide them a lunch or create a potluck, right? So it's more of like, like a family thing. It's a family style thing. It brings everybody together. As well as during those meetings, we'll highlight birthdays, and then we created quarterly awards. With the quarterly awards, different categories that I have is like most productive, most improved, best attendance, and then also care coordinator and care manager of the quarter, which is peer awards, right? So they get to recommend who they feel like was the care coordinator of the quarter, care manager of the quarter, and we get to highlight those team members. In addition to getting the award, which is you'll see the picture there with, I want to say from our first award. We have an internal system within Chicago Family called Bonusly, where you can give out points, and then those points can turn into actual dollars. So in addition to getting the actual physical award, they actually get Bonusly points as well. So that way that everybody in the organization can see them and actually add points to the recognition as well. Monthly one-on-ones. Monthly one-on-ones are very important, right? Because this is individual time that I get to get with my team. When I first started, I had a team of about 15, and now I'm down to about, I think it's 12 because of the state of everything right now. So I have to do a couple layoffs. But being one person, 15 people when I started across 6 different sites, I knew it was going to be important for my staff to get to know me personally. And I remember the first time I went to another clinic, they were like, well, you're coming over here? We don't have to come over there? It was so foreign to them. They're like, our other manager never came here. And I thought it was important because I'm like, I need to see what you're working with. And I actually learned a lot. I seen people didn't have screens set up. They didn't have phones. They needed supplies. People were buying supplies instead of ordering it properly. Like there are a lot of things that we miss when we have people at different sites and we don't actually get to engage with them in their space. So it's important to be able to take that time and go see them. And even if you can't do it monthly, which it became hard to do monthly, being honest. So now I do it quarterly, my one-on-ones quarterly in person, and then those other months I'll do them virtually. Just a little tip there. But it also gives me an opportunity to get to know them more personally, right? I've learned that people care about you caring about them, right? So learning to talk to them more than about work. When I start my one-on-ones, it's always about how they're doing. I never go right in and just say, okay, so these are our goals. This is what you want to know. How are you? What's going on? Maybe in the previous one-on-one they told me about their dog or something that's going on with their family. I make sure to bring that back up the next time we speak so that they know I'm listening to them and I care about what they care about. Monthly productivity highlights. So this was actually something that we initiated to keep the team motivated as well as just drive that competition a little bit, because when you're seeing what other people are doing, then it'll kind of push you to do a little bit more. So productivity highlights. So my team actually sends me a daily report at the end of the day. And then from there, we do a weekly report, and I compile it into a monthly report where I'll highlight those people that may be performing a little higher than others, but also not even that. I'll highlight those employees who may be improving, right? So I don't want to discourage anyone because maybe you're constantly performing low, but maybe you're doing better from your standards, right? From where you were before previously. So I always like to say that, but since I've initiated this, I've seen different employees like jump up to the top. Because it's like, okay, you see a couple of the names all the time. And it's like, how can I do that? And I have people who are surprised and they're like, oh my God, I made it. But they're excited. They're like, thank you. And I'm like, no, thank you. You did the work. They're thanking me for highlighting them when they did the work. So it's like a reverse engineering thing. Weekly huddles. So my team, they're all doing different programs. So I make sure to connect with them on a weekly basis just to talk about the programs, to make sure that they don't need anything in regards to their programs. There's not any questions or issues, but also it's a good time to be able to update them about what's going on in the organization, right? So I use those weekly huddles to do that. Open door policy. Very important. Like I mentioned, we're on site at our main location, myself, Dr. Osiname, and Teresa, where all of our offices are like right in the corner together. So when we're in the office, doors are open. Unless we're in a meeting, right? Our doors are open. The staff are comfortable. They'll come over. They'll speak, so we want to make sure that they know that we're here and that they can always come talk to us. So the impact, right? I know you guys are like, does this stuff actually work? And I would like to say yes. So I surveyed my team since implementing this, a lot of these things, and just to see how they felt about it. So you'll see that most of my staff have been here between 3 years and 9 years. And that's a long time. So that means they've seen a lot of different managers coming in and out. 100% of them feel more engaged since I've initiated these programs. 100% of them feel prouder to be a part of the team. 100% feel more respected by the team because, again, when you think about the peer-nominated awards, the birthday celebrations, the potluck, that's stuff that they're doing with each other. So now they're getting more of a value as being a part of the team, not even just appreciation from leadership. 100% feel more supported by their manager. Like I mentioned, the previous manager, they said, we never seen her come over here. So when you start to see your manager and they have a sense of presence around you and thoughtfulness, then you feel more supported. Now they come to me sometimes they call me and it's like, okay, remember, this is work, because it's like, okay, we're getting comfortable. But I love that they feel supported in that sense of safety with me at the same time. 83% have had a change in desire to be at the organization. And just from a comment that I received with the one, it wasn't that she doesn't feel less, it just hasn't changed. She wants to stay at the organization. So she's like, okay, my desire hasn't necessarily changed, but she does enjoy the impact. So what are some tips for you? Investing in your leaders, right? Because I did not become this person without my organization investing in me. I went through 2 training programs when I first started as a leader, which really gave me a lot of the tips and things that I've been using with my team. My team has definitely noticed a change in me since I took these trainings. When I first started, right, I even told them at the training, when I've always had like a boss mentality, leadership, right? I was captain of this team, president of this organization. So I had a niche for actually, leading. Well, not necessarily leading, but controlling things. But it wasn't until I went through these training programs that I learned how to properly lead people. And the biggest trend that I found was compassion, right? So I had to really shift my mindset from managing the people, do this, do that, this is how you do it, but what do you want to see? How do you think it should be done? And really taking their input and using it for them. So 2 of those things. So I went through community health advocate program, which was about a year almost. So that was for CHW management, and then the safety net leadership collaborative. I did that through MHN, and I'm actually going to be doing 2.0 soon as well. And then there's an ongoing initiative that we have in our organization with Haran, which is for all of our leaders, where we're learning each other's leadership styles too. So even that training has helped me with dealing with my boss, right? Because when we first started, there was a lot of clashing. But learning her style, learning my own style, now I'm able to communicate with her, which also impacts our team. Because when they see that we're working well together, then we have more of a comprehensive team too. So investing in your leaders, because those are the people that your team, right, are mostly affected by. I've been talking about this a lot. Leading with compassion. Staff need to be heard. They need to feel that they are valued, and that happens through communication and transparency. So as I mentioned, regular one-on-ones with your team. This helps build those personal relationships that create a safe space for your staff. They may share some things that they may otherwise not be able to share, because when we're in team meetings, maybe I may ask a question like I asked to you all, what is engagement? She answered, right? Somebody else may try to talk to me later about it, because that's just your style. You're not comfortable speaking up in front of groups, and that's okay. So these one-on-ones offer a moment for them to say things that they may not want to say in front of the team. And again, getting to know them more personally. And then creating and being able to celebrate wins. So birthdays are a big highlight, as well as life changes, right? When there's losses in our on our team, we may send a card around for people to sign so they feel important. And it's like, okay, they care about what I'm going through. And producing results, right? So say what you mean and do what you say. So engaged employees are the result of reliable leaders. So this is actually a picture of the what I was telling you guys about from my annual meeting. So I had them split off in groups, and then I put it on my wall in my office so I wouldn't forget what I told them we would do, so I could hold them accountable. So they come in my office and they see this, and it's also another affirmation and confirmation for them that we didn't do this for no reason, right? So that's a tip too. But create space for your staff to express their wins and areas for improvement. So even if it's not maybe this annual meeting, but maybe you do it one time just to kind of recalibrate your team and your goals. You think about that. I did it at the beginning of the year. I'm going to do it again at the beginning of this next year. I just think it's a great time to do it, right? Because we're all thinking about the new year and what we want to do in our personal lives. Why not do that with work too? And communicate your plan and support the initiatives. So on these sheets, they put out things that they feel like. So they listed 3 things that they felt like were issues, areas for improvement. But not only did they do that, they also, for each area that they felt like needed improvement, they gave an idea for how to improve it. right? So it wasn't on me to just solely say, okay, how am I going to solve this problem? How do you think this problem can be solved? And then I took those ideas and decided which one were actually what was workable and what I could do, and who I needed to collaborate within the organization to do those things. I did communicate my progress along the way. So I created like a stoplight report. Are you all familiar with those? Like the red light, green light, yellow light. So highlight. So I was able to show them these are the things that I've done already. Here are the things that I'm still working on. And here are the things that have not yet been started. So a lot of the things, I think is maybe one area that's still pending just because it's an ongoing process for that one. But also just holding them accountable to their role, right? Like I mentioned, a lot of the things that they said they wanted to see improvement in, like better resources was one, right? My team is solely responsible for providing resources to our patients. That's a lot of stuff. So I'm like, well, I can help. They thought that it would be good for us to have a central space for us to have all of our resources together. I think that's a great idea. Can you send me resources that you found? And then I can create the space. And as you continue to work, if you find resources, send them to me and then I can upload them into the space that's shared for everybody. That way everybody can see what's going on. And it's worked really well. Everybody, so we have resources, we created a folder, and everybody contributes to that. And that is the end of my presentation. Do we have any questions? Thank you. Yep.
Thank you. I love your list of where you started with annual planning and quarterly.
Mm-hmm.
If you could pick one for the where to start immediate impact, what would you pick?
I would say one-on-ones if you're not already doing those. One-on-ones is a great place to start again because it allows you to build personal relationships with your team, but also giving you an idea of their goals as a individual for work. We utilize Paylocity in our organization, and in Paylocity they actually have templates for one-on-ones. So it already gives you pre-written questions to ask during those one-on-ones, which was a great guide for me. So I didn't have to go in necessarily trying to create my own questions, but you know, obviously you'll come up with, based on the employee, you may come up with additional questions based on those. But I would say one-on-ones is a great place to start. Yeah.
You can AI those questions too. You don't have to Paylocity.
That's great. Yep. We were just talking about AI. Great tool. Any other questions? That was a great question. Thank you. Yes.
For the lunches, does Chicago Family give you a budget for employee engagement?
No. So there, unfortunately, there isn't a budget. But myself, the director, and our CMO will come together and we'll get something that's pretty feasible for all of us. So pizzas, you know, something like that that isn't too costly that we can do for the team. But I'm sure organizations do have budgets. I would say ask about it because it could be surprising what they have for you. Yeah. In the back. Mm-hmm. That is a great question. And actually something that I'm dealing with directly with my team. I actually have two care coordinator leads who are actually losing their titles and they're going to be getting a decrease as an effect of that. And something that we've been talking about is one, ways to balance the load that they had, because my expectation is for you not to necessarily want to do all of this work that you were doing now that you're not going to get the money. So what are ways that I can assist or we can balance out the load amongst the team? But also just being transparent with them because I haven't gotten a raise that I was supposed to get, right? So it's not only impacting you, but it's impacting me too. So that transparency is important. And just like we talked about in our opening session, just remembering why we're doing the work that we do, right? And that's why it's important to have people in your organization who are dedicated to the mission, the vision, and the patients rather than just doing it for the money. So when I would say even that goes starting with your interview process too, that you're making sure that you're hiring people that are going to, when those type of things happen, yes, it affects me because this is my livelihood, but also I'm committed to sticking this through because, like we always tell them, we had a state of the organization meeting that our CEO led, and we've been here before. This isn't new. The economy is always up and down, but we've gotten through it and we'll get through it again. So just keeping your doors open, being willing to listen to them, and then connecting with them directly in ways that you can. You're welcome.
A lot of your engagement has blocking provider schedules.
I'm sorry.
If you're gonna do like quarterly meetings or things like that, blocking provider schedules. So like, does your CEO or president ever say, "Oh, we're encounter rates, we don't have as many, or providing the provider salaries and not having those schedules blocked? Is that ever a problem?"
Well, fortunately for me, my team doesn't necessarily, they don't directly work with the providers, so we don't have to block the provider schedule. But my tip would be to do it during lunch, like a lunch celebration where so, and like if you have a meeting, because still, like even provider meetings, like within our organization, they may start them before the clinic opens, right? And then you can leave early or flex. Those are things that I would do if it does impact the providers or the provider schedule, like with the MAs, like our clinic managers, they'll do their meetings before the clinic opens too. They'll provide breakfast. So I would say maybe managing it around the outside of clinic hours, but making sure that you're working with the team to flex their schedules if they do come in before or after work hours. Does that answer your question? I'm sorry. Yeah.
We limit how much we impact provider schedules. If I'm blocking provider schedule, it has to be grant funded. So it's very rare that I would do that.
This is our CMO, if you wonder. They're like, who's this lady talking in the corner? This is this lovely CMO I kept mentioning. Mm-hmm. Yes, yes.
It's also very expensive. It's expensive to pay all those salaries when there's no revenue coming in, and then access to patient care and things like that. So we've kind of done away with those, but it's still important to have your required training.
Yeah, and just think about ways that, again, you can make it a work meeting. Like even if you could bring in people who are willing to sponsor the lunch, and then it's also like, so it's like a lunch and learn. Those are different things to do. So we're still technically working. So just ways to get around some of those things. Great questions. Anybody else? Any other questions? I don't know what time it is. I don't know how much time we have. Any other questions? Okay. Well, thank you all. I hope you enjoyed the session and that you learned some tips. I'm sorry that I did not include my my contact information in the presentation. I do have some business cards as well as a digital version. If you do want to have my contact information and stay connected, I'll be happy to talk to anybody outside of the conference to give any tips or any input. So, thank you.